With more and more states experiencing spikes in coronavirus cases and COVID-19 hospitalizations, the debate over wearing face masks is creating a sharp divide among some Americans. In a moment, William Brangham will talk with a doctor about the evidence surrounding masks. But first, he begins with this report.
Even though nearly everyone in the public health community says wearing a mask in crowded places can help slow the spread of this pandemic, for some, masks are an affront.
I understand the coronavirus is real.
Former Major League Baseball player Aubrey Huff summed up this view.
Hell, I would rather die from coronavirus than to live the rest of my life in fear and wearing a damn mask.
Every week, social media lights up with videos of people resisting mask requirements.
I work for Costco and I'm asking this member to put on a mask because that is our company policy. So either wear the mask.
And I'm not doing it because I woke up in a free country.
On the flip side, there are numerous stories of people engaging in mask shaming. Like here, where shoppers in a grocery store hound a woman for not wearing one. This fight is also spilling into government.
Wearing masks decreases the shed of this virus.
In Montgomery, Alabama, after a parade of doctors and nurses testified about the surge of COVID hospitalizations and the need for masks, the city council on Tuesday voted down a face mask requirement.
I think this is an overreach of government. I think to make somebody do something or require somebody to wear something is overreach.
But the next day, Montgomery's mayor passed an executive order requiring them. Some governors, like California's Gavin Newsom, require everyone wear masks in public places. But Greg Abbott, the Republican governor of Texas, has banned cities and counties from fining residents who refuse to wear them.
All of us have a collective responsibility to educate the public that wearing a mask is the best thing to do. Putting people in jail, however, is the wrong approach.
The Centers for Disease Control and Prevention and the World Health Organization both now recommend people wear cloth masks as a proven prevention strategy. But that wasn't always their recommendation, and that reversal has added to people's suspicion. Dr. Anthony Fauci recently tried to explain that change, saying officials were worried about early mask shortages for healthcare workers.
We wanted to make sure that the people, namely the healthcare workers, who were brave enough to put themselves in harm's way, we did not want them to be without the equipment that they needed.
President Trump this week suggested some people choose to wear masks not for protection, but to signal they don't like him. And with rare exception, and against the advice of his own officials, the president has repeatedly refused to wear a mask in public. Across the country, many of his supporters are following his lead.